Millions of Americans have to deal with back pain from time to time. For others, chronic back pain can keep you from doing the things you love. Dr. Stacy Chronister, an internal medicine specialist with OSU Medical, joins us this morning to talk more about how to deal with back pain. Good morning.
Good morning.
It is pretty common.
It is common. It's one of the most common complaints we receive in the primary care clinic.
People come in and they say, my back's been hurting. Now, there are acute pain and then there's chronic pain.
Yes.
How do you differentiate?
So someone who has acute pain is usually, hey, I went out and I raked my yard this weekend with all those leaves and now, oh my gosh, I can't hardly stand up. That's what I would consider acute versus that someone who has that just chronic ache in their back that maybe comes and goes over time. That's what I would consider more chronic.
When we talk about back pain, what, I guess, symptoms might people be experiencing?
Yeah, so usually it is low back. Upper back is a little bit different, but low back across both sides, not one side or the other. And it really shouldn't radiate anywhere. So they should not feel it down their legs and into their groin. It really is just located right here. And it can have a lot of different ways that it feels sharp, or it can even just be achy all the time.
Let's talk a little bit about imaging, because most of us are like, tell me what's going on in there.
Yeah, and actually most back pain does not need imaging.
Okay.
There's a few red flags that I think of when I say, oh, someone needs imaging. That's somebody who I think has had significant trauma happen to them, someone who's been on steroids for a long time. A lot of people are on chronic steroid inhalers for their lungs. That's someone I'd be thinking of if we have new back pain. If we have a history of cancer, if you're having fevers, that's certainly someone that I'd be thinking of. Another problem that I would think of is if someone is having loss of bowel or bladder control, suddenly you kind of realize, oh, something's different down there. Absolutely, we need to get some imaging.
What is the problem? I mean, why do we have back pain?
It's chronic overuse, and that can come in different forms. So of course we think of that person who's like overusing their back at work, right? But really, a lot of us, we have chronic overuse because we don't have very good muscle structure up front. So if we are having any weight that we're carrying in our abdomen, that is actually putting a strain on our back at all times.
Okay.
So people say, oh, I need to lose weight, which is correct, and that would help, but they think, oh, let's go out and walk. But without that good structure there, you're actually putting more pounding on that back with every step you take.
And increasing the pain.
And increasing the pain.
So what do you want us to do?
So really, we need to improve our abdominal muscles.
That core?
Yes.
Okay.
So weight loss will come with that, hopefully, but either way, we will carry it a lot better and we will support our back better. I really encourage planks. Planks are hard, I understand, but there's easy ways to do them. So you can even go into the kitchen and even while you have food in the microwave, just put your hands on the counter and wait until you kind of feel it in your core.
So I'm pushing off. Pushing against.
Just like you would be doing a push-up position.
Right.
Absolutely.
Till you feel that kind of strengthening there, and just do that a bunch of times?
And it probably would only take 10 to 15 seconds before you really feel it, but you might be able to build it up to a minute. You might even be able to eventually get down on the ground.
And do the plank.
And that'll really support your back.
I heard somebody the other day say, I don't even know what a plank is. And it's, you know, the people lie down and they're on their elbows.
Yes. Oh, it's a tough one.
Yeah,
yes,
supporting.
Absolutely.
But it's very helpful to help build up that core. If someone's out, you know, doing some activity and they torque their back, how do you treat it immediately?
Immediately, we don't want you to go lay in bed. Okay, because that's probably one of the worst things we can do for our back. We want to keep moving, but we want to avoid strenuous or repetitive exercises. So if you have a hurt back, I don't want you bending over and loading and unloading the dishwasher.
Or the washing
machine. Exactly, because that's going to put that much more pressure on it. But I do want you moving through the sitting, laying, standing position throughout the day. Ice is really a great idea there. A lot of people think, oh, the heating pad, but there's a lot of inflammation there, and that's actually increasing that blood coming through. What we want to do is cool it down and shut off some of that blood flow, and so we want to ice it in the immediate.
Ibuprofen can be your friend?
Absolutely, because that's an anti-inflammatory. Now, not everyone can take ibuprofen, so if you've been told not to take it before, then don't. But that's an easy way to help decrease some of that acute inflammation.
I wanted to ask about massage and going in for an adjustment.
Yeah, absolutely. Adjustments can be great. Massages can be great, but if you have an acute back injury, I would hold off a few days to a week or two until that kind of the swelling goes down before I would get any adjustment, because you might actually make it worse in the acute setting.
All great stuff. Some people may want to wear support belts. Is that a good idea?
I think that if you're doing a lot of heavy work throughout the day and you're wanting to prevent your back from hurting and until you really build up your core, some of those support belts can be very helpful.
Excellent. All right. I know what I'm doing when I go to the kitchen tonight. And hopefully we'll be able to transition to the ground and get those planks in. Thank you so much.
Absolutely.
Great information. We'll see you again next month.